First of all, I'd like to thank Dr. Rai for inviting me to the forum today. I really didn't know that something like this existed, and I just want to say thanks. I first want to talk about my hip surgery. After I wasn't going to talk about that, I was going to explain my time in Florida, but I just want to touch quickly on wait times for hip surgery. In 2015, I was diagnosed with needing hip replacement. It took me, well, the required days were supposed to be 272, I believe, at the time. It took me 2.5 years from the time I was noticed that I had the bad hip and x-ray showed I need replacement to when it was replaced. The wait time was ridiculous. I was in massive pain. I had bone on bone. My hip was what they call sharding, where there is shards. And the answer to that was opiates. The first time I was prescribed opiates is when they noticed that I had a bad hip. A year later, when I wanted to get my hip replaced and still wasn't getting any date for it, I went to the doctors again. The answer was more opiates. Finally, 2.5 years later, I got my hip replaced. Now, me and my wife were on a trip to Florida. We had a 2-week cruise. We were coming back on the very last day after 14 days, and I got extremely sick on the Saturday. Sunday, we were to dock in Miami. I stayed in the ship's hospital hold till an ambulance picked me up on Saturday morning once we docked. I was taken to Miami University Hospital, where there was no hallway I was sitting in. There was no hallway medicine that we talk about here. I was out of the ambulance, and I was taken straight to a bed. Now, this bed was just a bed, and there was probably 20 of them in a row. But there was people everywhere from the lady beside me was pregnant and was having some issues with bleeding. She didn't have a wait time to get in there. I saw a doctor or a nurse, and it was assessed right away. Asked me about my pain level. I said it was about 11. I hadn't had any pain medication since before the ship docked. And right away they got, I believe it was Dilaudid or something they gave me, and it really helped. I was issued a room the same day. I had a CAT scan within 2 hours of being admitted. During the 11 days I was there, 7 of them were spent in ICU. Now, once I got out of ICU, I wanted to come home. I'm in Florida. I haven't been home for now almost 3 weeks. I just want to go home. So they have a coordinator that can coordinate you being sent home, whether you're in Canada or any other country. Now, she said about to do that for me, and they were going to have a jet with a doctor and a nurse to take me back to London, and they were going to meet me in London. All that was arranged. The only thing that stopped it, apparently, there's no beds. So on the 7th day, turned into the 8th. My wife was with me. She was extremely upset. We have kids at home. We couldn't leave. Again, we asked what was the problem. They said lack of beds. I said, okay, I will take a hospital bed in St. Thomas, Tillsonburg, Woodstock, anywhere, but I need to get home. She agreed and went and checked all these hospitals. Again, no beds. Day 9, I'm getting better and I want to go home. They will not let me leave unless I can get into a hospital bed in London. They check again, no beds. Day 10, I want to go home. My wife's extremely upset. So, again, they tell me no beds. Luckily, I met a doctor that was in there, and we talked, and he arranged that I could go home because I had spent now 11 days and was well enough to travel. And I didn't necessarily have to have a hospital bed in London when I got back. So when I did get back, I went home, and the next day I seen my doctor and was admitted to the hospital. When I was admitted to the hospital, I waited in the hallway, again, for 4 hours before I was seen. When I was seen, they never did much, gave me more opiates, and sent me home. A month later, I had another attack. By the way, I was diagnosed with pancreatitis when I was in Miami. I had another attack a month after getting back. An ambulance was called. I was sent to an emergency. 2 paramedics came into the hospital with me, and I was laying on a gurney for 3 hours while the attendants played hopscotch with a couple of the nurses. They couldn't leave, and I imagine there was more patients out there or people that needed them, but they had to stay because of rules till I was seen. Again, the same thing happened. I was seen. No x-rays, no CAT scans, no nothing, more opiates, and sent home. A month and a half later, I had another attack, a severe attack. I called an ambulance and again was taken to emergency. Again, a 6-hour wait in emergency. This time I was extremely sick. I was vomiting from the time I got into the ambulance to when I was laying on the gurney in the hallway. I'm a very loud person when I vomit. You can be heard. I imagine half the hospital hear me. But for 6 hours, I laid on that bed with a bucket in my hand and vomiting loudly, and nobody would come to me. I asked, and my wife asked, and they said that nobody was available. Finally, after I believe it was 6.5 hours, I was seen. And this time, they sent me for a CAT scan. Now, the CAT scan showed that I had a cyst on my pancreas, and it's called a pseudocyst. So right now I'm in the midst of getting an operation later on if I need it to have it removed. But whether I get it done in London or not, I don't know. If it was up to me, I would go back to the States. I was treated like a king in Miami. I had a room that was one-person room. They do not have any two-people rooms. They do not have wards, at least in this hospital that I was at. Now, mind you, I had insurance when I traveled. If I didn't have insurance, they would have sent me to what they call a county hospital. Luckily, I was insured. I counted up, I think, almost $420,000 that the insurance had to spend to get me back home by the time they were finished. Now, I heard MPPs when I got back saying that the insurance companies were not doing enough to get these people back to Canada. Well, I can tell you right now that's not true. The insurances did not want to continue to pay $100,000 a day for me to stay in Miami. They were doing everything they could to get me back. There was another gentleman that was stuck in Mexico. He was 79 years old. He was there the same time I was in Miami. He was there for 2 months before they could get him in bed. I think it was 54 days before he got back to London. And actually, they put him in a Woodstock hospital where he died. But he was stuck in Mexico for 2 months. What the hospitals are like in Mexico, I don't know. But I can tell you, I wouldn't want to be there. Being a 79-year-old man with extremely ill and not being able to get back to Canada is a big stress on his family, his wife. And like I said, when he got back, I think it was 4 days later, he died. All I want the MPs to do is listen to some of these stories and understand. I know that it's money, but people pay taxes, and there's no reason why we can't get good health care here. The United States has 10 times more people than we have, almost 300 million. And I got treated fairly and extremely well when I was down there. And they have a great health care system. Now, they say that it's 2-tier. Maybe it is. Maybe I was at the 2nd tier when I was down there because I had insurance. But if that's what it took to get that kind of service up here, I would be down for 2-tier. So whatever it takes, I think that we should really think about it and think about the people that have to suffer. Not only the people that are in the hospital, but their families. It extends to more than just the patient. Thank you.